Hello, everyone. My name is Wolem Lee, a second-year medical student at BMMD. Today, I will be interviewing a great guest speaker, Dr. Yatin Chadha. Dr. Chadha is a community radiologist specialized in musculoskeletal radiology and also a founder of Beyond MD podcast. I'm a huge fan of his podcast, so I would love to talk about it so much. But instead of me continuing the talk, why don't you tell us a little bit about yourself, Dr. Chadha?
Yeah, absolutely, Willem. And first off, thank you again for having me on. I think this is a really exciting initiative, and I'm certainly happy to be a part of it. So, I guess I'll tell you a bit about myself just from a professional standpoint, and I'll go kind of chronologically. So, I had the chance to do my medical degree at UBC in Vancouver. And that for me was a phenomenal experience because it was definitely my first chance to kind of move away from my hometown in Kingston. So I grew a lot in those 4 years. So a great time. And I have to say, I made some of my best friendships out there. So a lot of my friends are still out in BC, a great reason to go back there. And then for residency, I matched to radiology at Queen's University. And so that brought me back to my hometown. And I think one of the best parts, though, about that residency, Wolin, was the fact that it was a small group, a very good kind of staff to resident ratio. And there were also no fellows. So, really, when it came to diagnostic and procedural opportunities, it was kind of all for us. And so I think the learning opportunities at Queen's were phenomenal. So, anyone considering a radiology residency, it's something to keep in mind when you don't have fellows, although fellows can be instrumental for teaching and whatnot, and they help carry out a very important service. Just something to keep in mind. And then residency was also personally a very important time. And that's when I met my wife. We got married in fourth year and we had our first child in fifth year. So fifth year got very, very busy. And
Wow.
then to, just make things more exciting, we decided, you know what, we want some more adventure, and
Mhm.
then decided to head to San Diego for my musculoskeletal fellowship. So my son was 10 months at the time, and we were living in La Jolla for a year. And that was an incredible experience as well. I mean, one of the reasons I went down there was to train with the team there. And their group was kind of led by Dr. Donald Resnick, who's he essentially wrote the Bible of musculoskeletal imaging.
Mhm.
And, just a chance to work with him. I was very lucky because I was, maybe the last Canadian to actually go through that program because the rules have kind of changed since. But it was also his last full year of work. And so a lot of opportunities there, got to take part in imaging for the San Diego Chargers. So for me to, kind of gravitate to MSK and have that chance was wonderful. And so
Mhm.
when fellowship wrapped up, I was trying to find a job, and the job market in Ontario was quite tight. And in fact, my first job was in Calgary, Alberta. So we kind of continued our tour around North America. I worked in Calgary for a year, met some really wonderful mentors out there, and made some great friendships out there. A very busy practice. And then the opportunity at North York General came up about kind of halfway into my first year in Calgary. I took a shot, I applied, and when I got the interview call, I was actually in Argentina. I just finished hiking in Patagonia, and I was sitting in my
Wow.
hotel room, got the email, and I was actually getting ready to go back to Calgary, and they said, can you come for an interview? And so I had to work to kind of reorganize my flights, but well worth it. And I've kind of
Mhm.
been in North York since 2017. And I know that's kind of a long answer, but Willem, why I actually bring it out like that, why I laid out like that, is for me, it actually highlights one really important point. And I want people to think about this, and maybe it's a take home point, but in medicine, we have a really wonderful opportunity to train with different people at different centers. And I think if you take the plunge to kind of get outside your comfort zone and maybe take on that opportunity in a different center, it can come with so many advantages. Like, for example, when I went to UBC in Vancouver, it was my first time kind of living outside of my hometown, living on my own. I grew a lot. When I took the chance to go to a smaller residency program at Queen's University, there was so much diagnostic and procedural volume for me. I felt like it was a great place to kind of hone those skills and get ready for the real world in radiology. And then Calgary, one very fascinating thing about the practices in Alberta is we had a chance to do a lot of pain injections. So we'll talk about MSK radiology in a bit, but we were doing about up to 60 injections a day. They'd book 60
Wow.
patients a day, so every 5 to 10 minutes. And I'm not saying that that's how we should do things, but just
Mhm.
for me in that year to actually get all that procedural experience under my belt, it gave me so much confidence. And then when I came to North York General, I wanted to just grow a practice, not exactly like that, but just to introduce pain management. And it's a part of our practice now. So take the plunge, be open-minded. And I think that, medicine's a universal language. You can train anywhere as long as you're with the right people. And then
Mhm.
outside of all that, I know I've talked radiology now, but I have a lot of other interests. I'm big into sports. I'm a very keen golf and hockey fan. I play both sports, play ice hockey as well. And I'm a very proud husband, proud father of two boys who are 7 and 4.5. And I have to say, my wife and both my boys, they're the inspiration for everything that I do in my life. And
Mhm.
my latest adventure was 2020. I decided to start the Beyond MD podcast, which is a financial literacy podcast, kind of aimed to help healthcare professionals better navigate personal finance. And I know we're going to talk about that a little bit later, but that's a little bit about me.
Great. Thank you so much for the great advice. I completely agree with you. It's really important for us to get out of our comfort zone and really try to, try new things, try new places, try different settings.
Yeah, for
Yeah, I
sure.
think it's really important. Okay. So my next question for you, Dr. Chada, it's what made you decide to get into MSK radiology? Like, were you always interested in MSK radiology?
It's a great question. So, when you're doing your radiology residency, you will get exposure to all the different subspecialties of radiology. And as you do your rotations, you kind of get a feel for where you want to maybe spend a bit more of your time. And MSK was interesting because, Wolem, it's probably one of the only subspecialties of radiology where you really won't be doing too much of it on your call shifts. And so I find that compared to everything else, like compared to body imaging, compared to neuroradiology, you actually end up doing less MSK in your residency than most other things. So in that sense, I know that myself and a lot of my co-residents, when we finished residency, MSK was one of the areas that we actually felt the weakest in. So in the back of my mind, I kind of always had it, well, you know what? Human nature actually, what tends to happen is you want to spend more time in the areas you're comfortable in. But I thought if I kind of take a bit of a different approach, if I spend a bit more time in MSK, then I'm probably gonna, I hope that when I finish that fellowship, I will emerge feeling maybe a bit more balanced and a bit more well-rounded and ready to do general radiology. And I think for me, that's kind of how I felt doing that fellowship. So for me, it was the right mindset, I think, spending time in an area where you just naturally don't feel as ready coming out of residency. I think the other thing about MSK is the pace of work is a bit different. Like a complicated case in MSK, it can take 5 to 10 minutes to interpret a complicated MSK MRI. Whereas if you're dealing with a complicated post-operative abdomen CT, you're looking at like 20 plus minutes. It can be just a
Wow.
disaster. And, I think my personality is just a little bit better suited to things that require maybe a shorter attention span. I'll be honest, I have a shorter attention span than the average person. So I think MSK is kind of better suited for me that way.
Mhm.
The other interesting thing about MSK, and I was just giving this some thought, is you cover so many different imaging modalities. And I'll just compare and contrast it to maybe neuroradiology, which I also really enjoyed. But when you're doing neuroradiology, you're focusing mostly on CT and MRI. But when you look at MSK, X-ray is really the foundation of MSK. You have a lot of ultrasound, you have CT, and you have a ton of MRI. And then on the side, you may have to often interpret, or not interpret, but you'll have to reference bone scans. So there's 5 modalities right there. So it's actually quite enjoyable to kind of look at all those modalities, put the pieces of the puzzle together, and then kind of come up with a diagnosis.
Mhm.
I think one of the other things about MSK is often you're dealing with athletes, so sports medicine's a big focus. And it can be very gratifying to kind of offer a diagnosis, find a solution for a young, healthy patient, and when you kind of offer a solution in that context, it's a good feeling. You're helping somebody who got injured, they're young, they're healthy. And so that's something that's, I think somewhat interesting about MSK. And then I would say the last thing is, like many other specialties, it gives you a good opportunity to kind of balance out your work in the sense that you have diagnostic and procedural opportunities. So when you figure out what the cause of the patient's pain may be, then sometimes in the right context, you can offer a therapy, an injection. So it's a good mix. And so I think kind of for all those reasons. And then the last one, sorry, is my affinity to sports. You know, I'm a big hockey fan. Like I have a plaque of Sidney Crosby in my office. That's the first thing people see, and it's a good conversation piece. I've been an avid golfer. I played kind of all types of sports growing up, and so just to be kind of gravitate to sports, athletically inclined, I think that's kind of a natural driving force for MSK as well. So all those reasons kind of played a role for me.
Right. Thank you
Yeah,
for the great summary of MSK radiology.
yeah, of course.
Um, my next question for you is, can you tell us about your practice model? Is it private or is it academic?
Yeah, that's a good question. So I think many of us, when we're doing our residency, we're going to be, most often in an academic center, and where we're going to have working with staff who they're all kind of subspecialized, and we go through our rotations. And then when you enter the real world, you have basically a decision. I would say I'd break them down into kind of, academic community and then a hybrid academic community. So our practice model is a hybrid model where we are community academic. So we're a large community hospital with over 400 beds, a lot of different services, surgery, cancer, orthopedics, pediatrics, very busy emergency department. And so the bulk of our work is just head to toe diagnostic imaging, kind of covering all modalities. But then at the same time, why we are a hybrid community academic model is that we have an academic appointment with the University of Toronto, which is always nice to have. And the best part about that, Willem, is that we have trainees that will rotate with us. So what we currently have now is we have usually at all times one medical student and then one fifth-year radiology resident who will be in the department with us. So on top of doing our day-to-day diagnostic and procedural work, it's on us to teach these individuals. And so, it's a great chance to kind of teach medical students about radiology, why it's important. And then the fifth-year residents who come and rotate with us, it's a phenomenal chance for us to, first of all, keep up and teach them. And I think that makes it quite gratifying. So we are a hybrid model, community academic. Our hospital, our setup is such that while we are responsible to teach, you don't have to do research if you don't want to. But of course, if you're interested in it, no one's going to stop you. People are going to be happy for you to partake in research. So I'd break it down into academic, where you're teaching, you're doing research, and you're basically spending most of your time in one area. That's essentially what I was doing in Calgary. I was spending up to 80% of my time in MSK. North York is community academic. I take part in everything, including breast imaging. And then community hospitals, where you are just doing volume kind of all the time, maybe not getting the chance to work with learners as much. And then as a part of our practice, we also have several clinics. And so when you're at the clinics, you're kind of spending most of your day working by yourself, dictating cases. The bulk of it will be basic modalities like X-ray, ultrasound, and some bone mineral density. But that's kind of a basic overview. Hopefully that makes sense.
Oh, it makes sense. Thank you so much for the great
Yeah,
explanation.
no problem.
Our next question is, so what's a day in the life like for you, Dr. Chadha? Like, can you tell us about brief summary of like what your day is like?
Yeah, absolutely. I have to say, one of the things I really enjoy about working at a community center is that, every day I could be scheduled on a different rotation. So, and, I often joke with my colleagues and the technologists I work with. I'm like, guys, I rarely check my schedule until like the night before, the morning of. So I don't know what I'm going to be walking into, but it's really anything from head to toe. Um,
Mhm.
if I'm our days basically, I'll tell you kind of how they're structured. So you'll have probably part of your day where you're maybe doing some more acute work. So you could be doing CT scans or ultrasounds for emergency patients, inpatients, and then that might be mixed in with some outpatient work for the other half of the day. So
Mhm.
that's an example of a day where you're just sitting at a desk and you're just interpreting images. You're not actually seeing patients. And I know a lot of people will think, well, how much patient exposure do radiologists actually have? Well, depending on what rotation you're on, it can be quite a bit. So I do a lot of breast imaging in my practice as well. And that can be anywhere from 1 to 2 days a week. And on those days, I'm probably meeting with at least 5 patients and doing biopsies.
Mhm.
And so depending on how your practice is structured, so if you're incorporating things like breast imaging, minor procedures, interventional radiology, or even musculoskeletal procedures, you can structure your practice where so that even a general radiologist can have up to 20% of their time dealing with patients and interacting with patients. And for me,
Right.
I do enjoy that mix.
Mhm.
Whereas if you decide, hey, I want to be an interventional radiologist, so that means interventional procedures, you're going to be spending probably well over 50% of your time interacting with patients. So there's certainly the opportunity there. One thing I will say is that the day is usually pretty fast and furious. Like, in terms of the volume of cases, we're now finding that our volumes are probably above pre-COVID levels. And
Oh,
so you're
wow.
you're constantly busy. You're basically coming to work around 8:30 and working a solid 8 hours, and there are
Mhm.
no real breaks. You just kind of make breaks when you can, and you're just kind of working the day away. So it's high intensity, but most of the time pretty gratifying work. So
Wow. Thank you.
yeah, yeah.
Like, I thought if you specialize in MSK radiology, like I thought like bulk of your time would be just focused on MSK, but it seems like you're doing a lot of different kinds every day.
You bet. I am, but I will tell you, for example, in my previous practice, I worked a year in Calgary, and I would say
Mhm.
over there, about 70 to 75% of my time was in MSK for that year. But
I
then
see.
it kind of comes with the size of a group. If you're with a group
Mhm.
that's very large and that group has a lot of subspecialty trained people, you
Mhm.
can create different pockets and you can offer a service where you are basically having everyone who's subspecialized doing the majority of their work in that area. But a lot of
Right.
groups in the community, they're
Mhm.
smaller. Like we have between 20 and 25 radiologists. So
Mhm.
we don't have that size to offer that service. So that's why our service is kind of more based on modalities. So you're either
Mhm.
doing breast or ultrasound or CT or MRI, and then therefore you kind of have to cover everything.
Mhm.
Yeah.
Awesome. My next question is, this question comes from the fact that, there is a lot of talk going on, especially with AI coming out. A lot of
Yeah.
my friends are like, how's the job market will be like for the radiologist in the future when like AI is becoming a big issue, not the big issue, but like a big thing nowadays. So we wanted to ask you, like, how is the job market for radiologists and what do you think it will be like in the future?
You're asking, I think, the most important question here. And I don't think there's an easy answer to it, but maybe I'll kind of look at it in the near term and then kind of in the more longer term.
Yeah.
So in terms of artificial intelligence, yes, it's a hot topic, and I think every 5 years the impact of artificial intelligence in radiology is only going to increase. But we have to keep in mind, like artificial intelligence, we've been using this already for many, many years. And a perfect example is breast imaging. We have a function which is basically computer automated detection, CAD, and basically every screening mammogram that I look at, I interpret it myself first, and then I basically get the computer's assistance right at the end. So I've made the interpretation in my mind, and then the computer will mark out spots that it thinks are abnormal. We've been doing this for many, many years. So how
Mhm.
we use that function today is we kind of take our interpretation, and then at the end we kind of take into account the computer's interpretation, but then we put it all together, and ultimately it's still myself and my colleagues who are making the recommendation. I can tell you in my experience so far, if we relied only on the computer to
Mhm.
basically diagnose mammograms, in my opinion, we would be calling back a lot of patients unnecessarily, and we would be doing
Oh.
far too many biopsies. So right now, if anything, the technology is probably too sensitive.
Mhm.
Of course, with time, that's going to improve. And now there are technologies where they are working on detecting lung nodules, and they are working on more refined technologies that will basically pick up bleeds in the brain and analyze different lesions in solid abdominal organs. So that is happening. But one thing we have to remember, a couple of things. Even though technology is evolving, it takes time for that technology to be adopted. So in the near
Oh.
term, I think radiologist jobs are safe, because if you look at electronic medical record systems that family doctors use, like you have to remember, family doctors have been using really beat up archaic systems for like a long, long time. And some
Mhm.
of the more advanced systems, yes, they're coming onto the market and it's a good thing. But naturally in medicine, well, and for whatever reason it is, I find that technology, it takes time to adopt it.
Right.
So that's one of the things that is probably leading to some job security being
Mhm.
maintained in the near future. Um, and then the other thing is, a lot of clinicians still want to come and talk to an individual, a radiologist. They still want that individual interpretation. And a lot of people want to see that name at the end of the report. As for how intact and how much that's going to persist into the future, well, in my belief, honestly, is that it's kind of up to us right now in the field, and it's based on how we practice. Like if we,
Mhm.
as radiologists, if we want to spend the majority of our time, hiding in a corner, not interacting with physicians, then essentially it's possible that people could start to see our specialty as a bit more of a commodity. But
Mhm.
I think what's important for us to do in the specialty is maintain relationships with our referring clinicians. So one of my staff in residency, he told me every day, pick up the phone and talk to at least one clinician, have a meaningful conversation. So
Mhm.
if we are offering that service, I hope that people will continue to see us as consultants
Mhm.
rather than a commodity as the future goes on. I think as long as we continue to do that, people will still want to see a name on the report. So I think, as for how long are radiologists' jobs going to be safe, just like they are today, it's hard to say. I think if we do things well, I think the next 15 to 20 years for sure is safe. After that, it's possible AI could have more of an impact. But I think if we work hard at being consultants and offering that service, I feel like AI will be incorporated into our practice to kind of enhance how we interpret things rather than replace all radiologists. But I think we
Right.
have to be mindful of kind of how we're doing things. But one thing I will give your listeners is there is one investor in Silicon Valley. I think his name is Vinod Khosla, and he's actually been saying for many many years that radiologists are going to be obsolete. In fact, he had an article 2 years ago which said radiologists practicing in 10 years, could be more dangerous than computers because he thinks computers are going to have such advanced and accurate technology to make a diagnosis. But if you go back to I think they've been saying the same thing since 2010, and they've been predicting the downfall of radiology. They predicted it in 2015. They predicted it in 2020. Now they're predicting it 2025. So the time horizon kind of keeps going further and further. So
Right.
bottom line, I think if we do a good job, it's probably more likely that AI becomes incorporated into our daily routines rather than replaces us. So
Right. Thank you so
yeah.
much for the great perspective because, there is just so much info going on out there, and it's really hard to find like a good article or news with like a radiologist actually talking about the future of the radiology. So thank you so much.
No problem, no problem. And the only other thing I recommend to all the listeners is like you want to get different perspectives. So you want to get one
Mhm.
extreme perspective where somebody may say, hey, radiology is toast, but then you want to talk to people in the field too who are living and breathing this every day. Just make sure you get different perspectives so that you can make the best decision for yourself. So
Right.
yeah.
Awesome. Thank you. My next question is, it's actually my favorite question. So it's please tell us about your Beyond MD podcast.
Okay, okay, yeah. You know, uh, well, thanks for asking about it. So for me, the Beyond MD podcast, I'll tell you the function, the purpose behind it. The purpose behind it is to help healthcare professionals navigate personal finance. And kind of what led me to start it is I can tell you, I'll take you back to when I started practice. It was 2016, and I was messaging accountants, I was messaging lawyers, and I was kind of trying to become familiar with the steps of incorporating my practice. And I actually sent an email to an accountant. I think this accountant was at KPMG, and he sent me this long email with like 12 steps for what I need to take into account when incorporating, or these are the steps to incorporate your practice. And honestly, I probably understood 25% of the email. And I just said, like, you know what? It doesn't have to be like this. And then
Mhm.
after that, well, I mean, I incorporated fairly early, but after that, I had to look into insurance. So I had to look into disability insurance and I had to look into life insurance because I had dependents. And even that process for me, just to kind of figure out, okay, what do I need to understand about these insurance policies? I found that I wasn't grasping the information. It was a bit daunting. And so as time went on, I kind of had this material marinating in the back of my mind. And then when the pandemic hit, I said, you know what? I have some downtime right now. I have developed a real interest in finance. And I think there's an opportunity here to create something that's a hybrid model. Because I know many physicians, like even myself back in the day, when I was presented this information, I wasn't understanding it because I felt like it wasn't being delivered to me in easy to understand terms. So that's kind of my role on the podcast. I want to be sitting in the chair as the physician and just delivering information in a way that I hope is easy for people to understand, because we don't live and breathe this stuff every day. And, truth be told, we weren't really exposed to it much in our training at all.
Mhm.
But then I also feel like it's important for us to get, accurate information. So that's why I try to work really hard to find the right guest for each episode. So yeah, essentially, Willem, it's to help healthcare professionals kind of at all levels. I try to cover topics that are more simple and more complicated, just become more comfortable with personal finance, because my belief is we spend a lot of time training, we spend a lot of time studying, and compared to some of our peers, we will start to earn later. So I think
Right.
it's important, especially as I think it starts honestly in medical school and residency,
Mhm.
basic personal finance, but especially as we transition to practice, if I can bring something good to this world to help Canadian healthcare professionals, including physicians, if I can help them on that journey, especially as they transition to practice and in their early careers, in their early years of practice, kind of
Mhm.
do the right things, make the right decisions, I think that kind of sets one up for success. And then ultimately, my goal is to not tell people to obsess over money or focus on money. My goal is to help people feel comfortable with this topic, and ultimately it becomes second nature to you, and then you can kind of free up mental bandwidth for other more important things in your life. So that's kind of the aim of Beyond
Right.
MD. Yeah.
Like, I'm not just saying this, but I really love your podcast. I just started listening to
Thank you.
it last week, and I already listened to three. It was about the
Thanks a lot.
stock market investigation,
Yeah.
stock
Yeah.
market investment, Bitcoin, and the insurance, because those three are like a huge topic right now. So I
Yeah.
was like, oh, so that's what Bitcoin is, and now I kind of understand what's going on.
Thank you for listening. And you know what? It's interesting you bring up Bitcoin, because after I put out the Bitcoin episode, I was kind of scratching my head, and I was just like, well, what exactly am I adding? Because if you try to creep up with cryptocurrency, there are podcasts out there where they do 6 episodes on cryptocurrency a week. Each episode is an hour long, and they can't even keep up with everything that's happening. But I
Mhm.
guess with that Bitcoin episode, if I can just for a moment, I think the one thing I maybe accomplished with that is to encourage people to just stay open-minded, because there's a lot of people who may not like cryptocurrency. There's a lot of people who love it. I'm not encouraging a certain stance, but I think the whole purpose of that episode was just have an open mind. It's totally okay to learn about it. I think it's a good idea to learn about it, but that
Mhm.
was kind of the aim with that episode. But I'm glad you enjoyed it.
I
Yeah,
really loved it.
yeah.
Okay. So my last question for you is, do you have any advice that you would like to give for those considering radiology?
Yeah, yeah. You know what? This is a great question. I think my advice is probably a little bit more general first. Well, when I kind of look at the path that I took, ultimately, yes, I became a radiologist, but I think there were things along the way that I could have done better, and I just want to share this with everyone, regardless of whether you're thinking about radiology or some other specialty. But the way we are trained and the way we kind of take our path all the way from undergrad to becoming a full-fledged staff physician, it's basically every 4 years we're getting to the next stage. We do undergrad to get to med school to get to residency, and so on. And I found that along the way, I was always looking forward to that next step. Like when I was an undergrad, I was, I'll use this word, I was obsessed with getting into medical school. That's what I wanted to do. I felt like that's why I went to undergrad. But I felt like along the way, I kind of developed a bit of tunnel vision. I was kind of blocking myself out to different experiences. Like I feel like maybe in certain ways, I could have been a little bit more balanced in undergrad, maybe just
Mhm.
tried out for a few more sports teams, pursued a few more hobbies. And then when I was in medical school, like by the second half of medical school, I felt this pressure to, create posters for radiology conferences. And, while that did help, I felt like it almost became like a little bit of a rat race. So, and it kind of happened at every single stage. So for me, what I refer to this as is arrival fallacy. And, we in medicine are very, very, I guess, predisposed to it because we have to get to the next stage. Every 4 years, every
Right.
5 years, something new happens. And
Mm-hmm.
we're naturally, a lot of us are high achievers. But if I can give one piece of advice that I think is the most important piece of advice I can give, is try your best at every stage to just enjoy the journey. And that can be hard when everybody around you is maybe grinding to get to that next stage.
Mm-hmm.
But if you take the time to enjoy the journey, you know, you'll do things with a very clear mind. I think you'll make the most of that experience and you will excel. Like things will work out.
Mm-hmm.
The other thing for anybody in radiology, yeah, like you have to expose yourself to the specialty if you're interested in pursuing it. So when it comes to your clerkship years, I know a lot of medical programs will, and they'll give you the opportunity to do electives, especially in your 4th year. And yeah, take advantage of oh, take advantage of those electives. And yeah, you have to do some of those in radiology. You want to
Mm-hmm.
expose yourself to the day to day because you want to go in knowing what the field is like, right? So you want to get
Right.
exposure to diagnostics, exposure to procedures. But at the same time, the other part of that kind of elective advice is ensure that you try to do a broad range of electives because if you're truly interested in radiology, you are going to have a pretty fundamental understanding of different areas of medicine and surgery. So, for example, what I had the opportunity to do was I did about 8 weeks of electives in emergency medicine, because you get a broad exposure to to at least clinical presentations there. I did a
Mm-hmm.
month in respirology, a month in GI, and a month in neurosurgery as well. I found that just gave me good exposure. And it's not like I'm going to master those topics, but it's going to help me understand how are these clinicians thinking? Like what's important to a neurosurgeon when he's looking at a CT head or an MRI of the head? Like I need to know that. So to do these
Oh.
electives, it's extremely, extremely valuable if you're
Mm-hmm.
going to pursue a career in radiology.
Right.
And then the last piece of advice, again, maybe not radiology specific, but just be a sponge when you're a medical student. Learn as much as you can. There's a
Mm-hmm.
saying that they have, like, never turn down a consult. I honestly, I think it's true. And if there's one kind of story that can kind of illustrate it, when we were in UBC in 2nd year, we would have a family medicine elective, and it was in the summertime. So we would
Mm-hmm.
kind of get matched up. And I went to a town called Grand Forks, which was about 4 to 5 hours in the interior of BC from Vancouver. And I got there, and my preceptor, he was definitely a kind of an older generation physician, just working hard. He was working the equivalent of 2 other family doctors. And he said, you want to join me one day in the emergency room on the weekend? Do you want to spend a weekend working with me? And I said, yeah, sure, let's do it. And so I walked into the ER, and he just looked at me and he said, Yatin, today you're going to work. He's like, you're going to see all the patients. I'm going to make you grind. I'm just going to make you work all day. And I was just like, okay, like, you know what? That's fine. I don't know anybody in this town. I have nothing else to do. But Wolin, like those encounters, every patient encounter, every experience like that, it just adds to your knowledge base. And so the other
Right.
piece of advice I can just give everybody is just learn as much as you can, soak it in, and be a
Mm-hmm.
sponge. I know it's general, applies to people going to radiology and any other discipline. So I'll leave it
Right.
at that.
Thank you so much for the great interview. I really loved talking with you.
Hey, it's a
Like,
pleasure. Thank you for having me, and really nice to talk to you too.
mhm. And I hope to see more of your great, podcast in the future.
No, for sure you will. You will. You know what? Things have been getting busy, so I think I'm kind of back to releasing one episode every 4 weeks right now.
Mhm.
But yeah, plan to keep it going. But thanks for tuning into it. I do appreciate it.
Awesome. Well, great. Thank you so much.
Hey, pleasure, Willem. Okay, great to connect with you. Take care.
Thank
Thanks for having
you.
me. Bye. Bye.